Hi friends and subscribers, here I am showing you an oocyte retrieval in a patient, a lady who is 40 years of age, and her AMH is 0.6. So as we know, AMH is a marker of the woman's fertility and her ovarian reserve. In this case, a 0.6 AMH is a little below normal. So normally if you go through the books, you will find that AMH below 1.2 is labeled as low AMH. However, in IVF and in fertility world, what happens is any AMH below 2, we start seeing that the results are suboptimal. So I am showing you over here that even for a very low AMH case, if we do a good stimulation, it is possible for us to retrieve good quality oocytes that make the baby. Here you can see that below that silverish needle that is going through the ovary, that is going through the ovary, and those black balls are the follicles. It is aspirating all the follicular fluid inside, and one of the important contents of the follicular fluid is the egg or the oocyte. So you can see that we are going through all the different follicles. Here I will show you everything I'll describe everything in detail for you. Here you can see I am targeting the follicle, that's the black ball. Okay, I am moving the ultrasound to get a very good view of the target, and we are slowly thrusting the needle deep inside, and you can see that the ball becomes small, that is the aspiration of the follicular fluid takes place. Here you find that we have aspirated close to 8 plus small follicles, and we then later on send the fluid for analysis. Here you can very clearly see a big dominant follicle is being aspirated, and since this patient has very few follicles, it is necessary to aspirate as many as you get, even the tiny ones. Also in the past, in this particular patient, what has happened is her one ovary was operated, and since it was operated and removed, this patient has only one ovary that is there in her body, and that's the ovary that has been stimulated. So you can see even the tiny follicles I am targeting, and we are getting the follicular fluid out.
Yes, everything is fine.
Transvaginal oocyte aspiration is a gold standard procedure. When IVF was newly started, this procedure was usually done using a laparoscope, but nowadays the transvaginal oocyte aspiration is considered the gold standard. That one of the main reasons is that we have ultrasound guidance, which is giving us the ovary in a 3D configuration, means we can see the ovary through and through, which is not possible as per the olden style. The type of anesthesia that the patient is receiving is either a short GA, that's a short general anesthesia, or a spinal anesthesia. In both the cases, the patient is discharged within 2 or 3 hours after the procedure, and it is a daycare procedure. That means the patient does not stay overnight. The woman can go back to her work the very next day, and the total time that the patient spends inside the hospital is roughly around, I would say, 5 to 6 hours. 1 or 2 hours before the procedure. The actual procedure, as you can see on the timer, lasts hardly 5 minutes, and post-op lasts for hardly around 1 or 2 hours, followed by observation and sending the patient home. So this is a very tiny procedure and mostly painless. So what happens is, in most of my cases, I do not even go and give them something, an analgesic like diclofenac or tramadol or anything, because most of the patients are very comfortable after the procedure. Here you can see last 3 follicles are there, which I am planning to aspirate. One thing that happens is, technically speaking, it is very easy to aspirate a large and heavy ovary, but when the ovary is tiny, has less number of follicles and all, technically it becomes a challenge, because the target actually is very small. Sometimes it is hardly 1 centimeter or 1.5 centimeter in diameter, and on the screen you can see a zoomed up image, but to target that and get that little bit of fluid out, it sometimes becomes a challenge. Also, another thing that happens with tiny ovaries is that the ovary starts moving. I hope you enjoyed today's video. Thank you for watching till the end.